What is spontaneous recovery after a stroke? Have you ever wondered how some stroke survivors seem to improve without any specific therapy? This natural improvement is known as spontaneous recovery. It refers to the unassisted recovery of neurological function and symptoms that occurs after a stroke, particularly in the early days and weeks following the event. This recovery usually happens within the first few days to 6 months after a stroke, thanks to the brain's own biological processes that work to restore function and reduce damage. One key aspect of spontaneous recovery is reperfusion. This is when blood flow is restored to areas of the brain that are at risk due to the stroke. Sometimes this happens naturally as the body adjusts, while other times medical treatments like tissue plasminogen activator can help. When blood flow improves, it can save brain tissue and support recovery. Another important factor is edema management. After a stroke, the brain can swell due to a lack of oxygen, which can further damage tissue. Spontaneous recovery includes the natural reduction of this swelling, allowing blood flow to return and brain function to improve. There's also a phenomenon called diaschisis. This occurs when areas of the brain that are not directly affected by the stroke become less active due to the loss of input from damaged regions. As blood flow improves and swelling decreases, these areas can regain their activity, which plays a significant role in spontaneous recovery. On a cellular level, spontaneous recovery involves several processes. The brain can grow new connections, repair nerve fibers, and even from new blood vessels. These changes can enhance brain plasticity, allowing the brain to adapt and recover. Interestingly, these processes can happen not just near the stroke site but also in related areas of the brain. While spontaneous recovery is most robust in the weeks following a stroke, it can continue, albeit at a slower pace, into the chronic phase. However, it is important to note that spontaneous recovery alone often does not restore full function. This is where rehabilitation therapies come into play. They build on the natural recovery processes to help individuals regain as much function as possible. The extent of spontaneous recovery varies from person to person. Factors such as the severity and location of the stroke, the age of the patient, and the condition of neural pathways can all influence recovery. Clinicians can use predictive tools to estimate recovery potential, but these are not definitive for every individual. In summary, spontaneous recovery after a stroke is the brain's remarkable ability to heal itself through natural processes, especially in the first 6 months. It lays the groundwork for rehabilitation therapies, which can further enhance recovery. Understanding this natural recovery can help healthcare providers optimize treatment strategies and improve outcomes for stroke survivors. Always consult with healthcare professionals for personalized advice and guidance on recovery.